Hi, my name is Dr. Rudra Mohan, and through the Oral Health channel today we're going to be talking about how to go about the dental management of medically compromised patients. Let's start. So today's episode is going to be very interesting, and I'm going to keep it as short as possible because it is going to be a long episode where I'm going to be talking about to you guys as medically compromised patients, any one of you who has some sort of medical compromise. I want you to understand, if you're having any sort of dental emergency, dental pain, or any sort of dental discomfort, what all you need to do before going to the dentist and after you have reached the dental office. So I'm going to be talking about in different categories, starting with the bleeding disorders. If you have unfortunately a bleeding disorder, which could be a coagulopathy, which could just be any sort of hemophilia, any sort of platelet addition deficiency or something like that, or you are a cardiac patient having undergone antiplatelet and anticoagulative therapy, that means you are under fibrinolytic therapy, that they're giving you drugs that make your blood more less viscous and more thin, that means they are on blood thinners. This is definitely for you. So what you have to do is, when you come to us for whatever problems, it could be extractions, it could be fillings, it could be orthodontic purposes and everything, we will take a brief history about your medical side, and also we will probably write you up with a referral. Once we have done the referral part, and we will get the tests done, which will include a hemogram, your APTT, PT, CT, and all those other tests, including platelet count, because of the fact that if you want to go for surgical aspect of treatment, you definitely need to have a minimum amount of platelet count available. Also, we will get your international normalized ratio taken out, so that we know that you are not a bleeding risk while the operation is happening or afterwards. Now, what is a bleeding episode? A bleeding episode is basically anything after the dental appointment, 12 hours, which stays as that for 12 hours, which is considered as a bleeding episode. For this, as we know, pre-operatively we will get the tests done. If you're not a fit for the procedure, we will not go ahead unless it's an absolute necessity. And if it's an absolute necessity, we will not take it up in the private practice. We will make sure that it is done in a hospital setting with all the life-saving equipment and the drugs that might be required during any sort of complications that might arise during the surgery or afterwards. Now, when it comes to other things, I'll be talking about asthmatic patients. Asthmatic patients, it can be very harrowing because you're literally gasping for breath. We will require a thorough medical history about you, what medications you're taking, because there are some medications that are contraindicated and react with the asthmatic medications. What was your last episode? How severe was it? Are you requiring steroid therapy, or are you under steroid therapy for such things? And also, we will try to make sure that the appointment is as short as possible. We'll try to keep the aerosols to a minimum, because especially restorative dentistry has a lot of aerosols that are produced. We'll try to keep the we'll try to keep the chair as erect as possible, so that you don't fall back on your back and there's pressure on your lungs. We always have emergency drugs intact, and also oxygen supply in case anyone undergoes a status asthmaticus. Coming to the third category, which is your renal disorders. If you are undergoing any sort of kidney issues, which could be nephrotic syndrome, there are a lot of drugs that are kind of nephrotoxic, so we'll have to be very careful. For all these things, we have to see your glomerular filtration rate, your output and everything. And for any sort of medical compromise, there is no way we're not writing a referral to your consultant doctor, physician or specialist, and only if they let us they give us the written application or the written assertion that the surgery or whatever needs to be done under following precautions, or it needs to be deferred to further notice till the things get better. Like, for example, if you're a patient undergoing kidney dialysis, now it's something you're under heparin, so you have anticoagulant therapy, so you have to be very careful about those things. Ideally, for dialysis patients, all the treatments are kind of deferred unless it's something very emergent. And on top of that, we choose to do the dialysis treatments right after the day of the dialysis, so that you are more comfortable. I personally feel if you're having these kind of issues, it's always better to get it done in a hospital setup with a dental wing. If you are having cardiac issues, that means you're having some sort of cardiac related problems, cardiovascular disease, for which you are taking anticoagulants, blood thinners or antiplatelet drugs, you have to report it to us, because we have to see the risk of bleeding intraoperatively or postoperatively, and we have to see if we have to withdraw the drug for some time. Also, the biggest risk of infective endocarditis, that means it is the disease of the walls. Basically, you have bacteremia, the bacteria enter the bloodstream and they can go and attach to the walls of the heart and can cause damage to the heart walls, thereby giving you rheumatic fever. We have to make sure that there are some medical conditions under which we need infective endocarditis prophylaxis. That's absolutely necessary. This also goes for diabetic patients who have uncontrolled diabetes or are under insulin, or their HbA1c levels are not that much under control. You have to be very careful. Cardiac patients, we have to keep the the environment of the dental operatory as relaxing as possible, not be stressed out, not stressing out the patients. And there are so many other things that we have to do. There are a lot of tests. I'm just literally touching the tip of the iceberg when it comes to telling you as a patient who is medically compromised. If you are a patient of convulsive disorders, you have to give us a brief history of your last episode, what medications you were on, because a lot of medications have some effect on other medications. They're counter indicated or contraindicated rather with other medications. And we have to see that if you have any long-term side effects of any anticonvulsive drugs such as megaloblastic anemia and all those things, we have to see that the chair light and all those stimulations, the stimulatory things that can cause you problems are made to a minimum. And we also have essential life-saving drugs in case you undergo any sort of grand mal seizures or any sort of seizures, clonic seizures, and we know the protocol. That is for us to know and for us to manage. That's very important. Now, finally, coming to the patients who are diabetic, it's very important for you to understand that if you are diabetic, if you're having uncontrolled diabetes, you're having controlled diabetes, depending upon your HbA1c values, you're on insulin, you're on medications, you're on antiplatelet drugs, you're on blood thinners, depending upon as a prophylactic use, you have to tell us all this, and we have to make sure that the appointment is done in the morning. We have the glucometer at our practice as well. And on top of that, we have to make sure that the appointment is as short as possible. You have to come on a full stomach, despite the fact that you've taken insulin or whatever medications you've taken. You cannot come empty stomach, because that can lead to a biggest complication, a very common complication known as hypoglycemia, which is a life-threatening emergency. Despite the fact that we have all the operatory, the machinery and the means and the drugs to save your life, but from your point of view, it is always better that you can make sure that you are fine and you can take care of yourself before coming down for the treatment. Now, the most important thing, and this is the concluding statement, if you are a patient of any of these categories and you wish to contact me regarding any queries, you can DM me on WhatsApp. But my main point is that if you are a medically compromised patient, please get the first appointment that you come to meet us, please get all of your medical prescriptions, your reports, your scans and everything. And unless we don't do anything, it is mandatory for us that we will write you up a referral to your specialist doctor, whosoever is treating you, and only if they are giving us it down in writing that the patient is ready to go for the treatment under the following conditions and under the following prerequisites, we will go ahead with the operation. Otherwise, we might have to refer you to your bigger center which has emergency equipment and handling purposes. So this was today's episode. Please like, share, subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Kindly refrain from calling me directly, as I might be busy with patients. Just drop me a message with your name, your location, and the common oral health problem that's causing you pain and discomfort, and drop me a message on WhatsApp, and then we'll have a word after 2-3 days. And I hope I can get back to you within 2-3 days, because I get a lot of messages. And if you have any queries, doubts, apprehensions, or insights, please feel free to put them in the YouTube comment section. So that's it for today. Thank you.